Are we ready?
We are ready.
All right, friends, we are back, and wherever you may be, you are right here with me. And we are on season 2 of the Pro Aging podcast. And is it going to be 4 or 5, Olivia? I'm not really sure. Depends how we lay this out. It's the new year. We have a lot of exciting guests to talk to. And, you know, we've taken a little bit of a turn. We talk a lot about what we do from the outside in. But as you know, when talking about anti-aging, I like to think of it as pro-aging, and so much of how we look and feel really starts from the inside. So we're having guests here talking about preventative medicine, precision-based medicine, integrative medicine, and really finding about how we could work from every angle to really live our best lives, both in our overall health and in the way we look. Now, as you know, I've always been interested in more than the injections or the laser, working from the inside. So I'm very excited to have this special guest here today. I do want to give a shout out to my marketing, PR, social media manager. I did get this fabulous, if you're watching me on video today, I got this fabulous Christmas gift of, is this called a mic holder? I'm not... A branding flag. You know, there are so many different bonuses to watching us on video. If you only listen to us, auditory, I do suggest that you check us out and watch us, because there are going to be some special bonuses in this particular episode with my friend and my colleague, Dr. Jake Deutsch. Now, Dr. Jake Deutsch is the founder of Oakwood Precision Medicine for Men. But oddly, he started out his very long career and is board certified in emergency medicine. Prior to launching Oakwood, he became quite renowned as being the founder of Cure Urgent Care in 2014, creating an enormously successful network of healthcare and award-winning professionals that not only provide essential urgent care, but really helped us all out through COVID, serving the community. And also Dr. Jake provided an enormous amount of information, both to me, my patients, and just the public in terms of informing people, much the way I tried to do myself. In fact, that's exactly how we became friends. He is also credentialed at Mount Sinai Health System, my home as well. Now, my impression is Dr. Deutsch has been interested in the field of preventative medicine for quite a while, and he put together Oakwood Medicine to really focus on men, helping them live their better lives. And the best part, kids, drum roll, is that Dr. Jake is right here alongside me under the roof of PFRANKMD, helping men live their best lives.
Wow, what an introduction.
Look at that.
Wow.
So I think, listen, I think what you and I do is really part of the future. This combined kind of tag teaming and concerted synergistic effort of helping people live their healthier lives, becoming more vital. So, we pass each other in the hallway like all the time, and now we finally get to talk about what we do. Thank you for coming.
This is fun.
Yeah. So, let's get right into it here. I first want to hear about how you got into it, because clearly you have spent probably a good portion of your career focusing on the immediate, the emergency, the short term. And I think, a lot of the problems with healthcare is that people sometimes become too short-sighted on what they need right now, and then they're going to ignore their health.
Yeah.
So tell me how you got into this preventative form of medicine, precision medicine, and how you created Oakwood.
Great question. Something that I think about a lot, because obviously it is my passion.
Yeah.
I've had a bunch of different hats and careers. And when I sold my urgent cares, I kind of was thinking what I wanted to do next.
Yeah.
And this is something I've been doing for myself for years. And the reason why I was so interested in the longevity, preventative portion of medicine is because my focus has always been about the worst case situation. People who are in dire straits, they're having a heart attack, they're having a stroke, they're having a diabetic crisis.
COVID.
Right. So that's where my brain normally is.
Yeah.
And what really occurred to me is that there's a need to get ahead of that. If we only look at how we can solve the problem when it's at its worst, we're really not getting to the root of good medicine. So this is where the idea really sparked interest in me. And of course, it's something that I've been doing for myself. When you talk about
always starts with our own self-interest, right?
And to be honest with you, it is so passionate for me, probably because it's changed my life. And, I really love that I can connect with my patients about something that I'm doing myself. Oftentimes physicians, if you're a neurosurgeon, you've never had an aneurysm. But you operate on them all the time. So it might be a little bit different to relate to that patient. And what I'm doing for myself, I'm doing for my patients. And therefore, there's this intense connection, which has been so different from any other part of medicine that I've practiced.
I think a lot of people, I think there was a stereotype of you want to go to this old, crusty, white guy physician but like a generation ago. And now you want your physician to set an example for you in many ways. It doesn't mean you have to be beautiful or this, but that you clearly take care of yourself and you live what you preach.
It's something that I believe in. Doctors in the 70s used to smoke while they were doing rounds in the hospital, but it's like going to a hairdresser who has bad hair.
Yeah, you don't go to a bald barber, although my barber growing up was bald and he was amazing. But it's kind of the stereotype. You need someone to respect the process.
Yeah, exactly. So, that's very much in alignment because, what I do for myself is what I do for my patients, and it's personal. And I think that people really like that.
Yeah. Now, tell me about Oakwood, the name, like how you started focusing just on men.
Right.
Like you're pretty focused here.
Yeah. So, guys are a separate entity in terms of what needs to be done for the process for the anti-aging and longevity. Women need this type of medicine too. I firmly believe that. But when I started the practice, I wanted to be very narrow and very focused. Hopefully it'll grow and add on the women's side as well.
Yeah.
Guys particularly are just not as in tune with their bodies. They're not as likely to take care of problems. That's why women suffer through illness. And they'll take the weight of the family on their shoulders. Men generally just are not programmed that way.
They're not self-aware physically a lot about these things, nor do they care. I mean, I think now we're seeing a lot in the media now about all these billionaire men that will remain nameless that are taking care of themselves and they're working out, and we know they're likely having help from doctors such as yourself.
Absolutely. And this is what's getting attention. But the reality is the attention for prevention, the attention for what you could do to live better. It shouldn't only be for billionaires.
No.
This really should be what everybody is thinking about. And there is a shift in the paradigm of what's happening in medicine. And there's so many wearable devices. There's so many integrations that we can use. It's a whole process that I bring to my patients' treatment that is changing how people think about their healthcare.
Well, I think, if there's one thing traditionally when people think of hormone changes, it's always associated with women's health. Because they go through menopause, they have a menstrual cycle. I think
it's tangible.
It's a tangible thing. You never think about andropause or what happens to men.
You should explain that. I mean, andropause is not a term everybody knows, but basically androgens are your male sex hormones. So a lack,
which women have too, right?
They need to have testosterone as well. But really andropause is something that's not understood or maybe even thought about, because you don't hear your dad when you were growing up saying, "Oh, I have low T, I can't, I have no energy and my thoughts are cloudy and my muscle mass and definition has gone away," versus you heard from your mom, or
hot
somebody
flashes,
in the family, right? I'm dying
or
here.
the stereotype that you're moody because you're having your menses. There are all these stereotypes built around women's health with that, and
guys not so much.
Guys not so much.
And so bringing it to a way that's very easy and user friendly was 100% part of the concept. So I wanted to make everything simplified for guys. Tell me what I need to do. That's what guys want. When you need supplements, I've created my own. I send them to you. There's no shopping for that. That's the type of things that I've figured out to make the process that much easier, because men generally get bored. They
need the direction.
So, this program that I put clients on basically is a full program with a timeline. There's steps that I figure out and sort of give that guidance. And what's really cool is the technology that I was mentioning before really is a part of Oakwood. So I have an app that has a health dashboard. So it's basically all of your information laid out in front on an app that I can view and look at my client's information. It's a little big brother.
Yeah,
But
you're like watching the internet browser and stuff like that.
no, I'm looking at, their blood pressure, the number of calories that they're burning. I'm looking at their sleep, because all of their devices that they're wearing, and wearable technology is exploding, go into the app, which is my proprietary app. And then I can coach and, really control and work with people on a one-on-one basis.
So this is going to bring us into the next topic, which is advancements over the last few decades. Because I remember in the earlier part of my career, I tried to have hormone optimization put in my practice. It was in the very kind of early stage of it coming out of its shell of juicing or things like that. And I think even in the last decade, there's been so much advancement. So tell me a little bit about the diagnostic and therapeutic advancements, and define what biohacking is for me.
Okay. Biohacking, I'll start there, is basically anything that you're doing to improve your biology. Yeah. So it could be something like fasting, intermittent fasting.
Oh, okay. I didn't know that.
That's considered biohacking. It could be using your Oura ring to monitor your sleep.
Right.
Your Apple Watch is a form of biohacking. Using supplements is considered biohacking.
Yeah.
So there's a whole range. It's just this umbrella term that is putting attention on what's happening.
Yeah.
So biohacking is like kind of a hot term. You're going to hear that a lot. If you search that hashtag, you'll get a lot of information for sure.
I've done that.
But so, I think the question is really, why now is this become so important and recognized? It's a lot like other things that you're dealing with in cosmetic world. People are no longer ashamed by it.
Yeah.
People are understanding that this is so you're going to live better.
Yeah.
It's not how long you live, but how well you lived while you were alive.
Yeah.
So people are looking at the idea of hormone replacement, and that's only one part of what I do, but using peptides or, just working into the physician on this level as something that is almost a badge of honor.
Yeah.
It's like, wow, I'm taking that initiative.
It's okay to take care of yourself.
Yeah, rather than saying, oh, you're juicing. And by the way, hormone replacement is very different from anabolic steroids and some of these other things.
That's important to know. We'll talk about that in a little few minutes.
But, there's been this shift in the understanding and the comfort that people have with this. And, I have so many people who are just so appreciative that I put something together that makes it easy for them.
Yeah. And in terms of the advancements, diagnostic and therapeutic, let's first talk about the diagnostic things.
Yeah.
Clearly, it's not just looking at blood work. There's a full diagnostic workup here, right?
Yeah, so you're talking about hundreds of blood tests and initial evaluation. And most primary care doctors, they'll do a basic blood panel. And, it'll include your basic cholesterol, your basic, blood count, your chemistries. But they don't go into the level that I do. So looking at a specific like cardio enzymes for your heart, inflammatory markers, not just looking at the basic tests when your doctor says, oh, you're fine. The idea of being fine is really not, I think, acceptable for most people.
Yeah.
So we're going in much deeper and looking at the stress hormones, the thyroid, in a way that most doctors don't even
And you
start
could
to
do
use.
this better now than maybe 10, 15 years ago in a lot of these diagnostic tests?
Sure. I mean, there's so many more,
There's just more, right?
options and availability that we could do. Inflammatory markers that we couldn't measure before.
Really?
Yeah. Looking at other specific tests when it comes to like your cholesterol. Most doctors don't even know how to look at the particle size and the apolipoproteins. Those are all sort of considered cutting edge.
Yeah.
But then there's even basic things like your A1C, which is a marker for diabetes.
Yeah.
That some doctors will say, well, it looks like it's a borderline, but what are you doing about it? How are you trying to prevent that diabetes from happening?
Yeah.
And that's where the advancements come in. So some of the technology that I spoke about, like glucose monitors, continuous glucose monitors you could use to understand how your body responds to sugar and if you're showing signs of insulin resistance. Right. So all of that is absolutely changed in the last 20 years.
So let's talk about the workup. A patient comes in, they're clearly looking for something more than the primary care doctor.
Right.
Let's assume it's probably usually a middle-aged guy. They're maybe not feeling like they used to. They've tried a little dieting. They try a little exercise. Like most men, they're confused. Mm-hmm. There's a lot of stuff out there. They sit down with you. Tell me what the workup is. Yeah.
I mean, it's a comprehensive intake in terms of like getting to
You
know
spend time with them.
Yeah.
Which is a big difference than what you get in a lot of primary care type environments, right?
Of course. I don't have to see 50 patients a day to meet my quota.
Yeah.
So it could be 2 hours, the initial consult, where it's a real health dive into your health history. From there, an extensive array of blood work, and then a body composition scan. So it's a 3D infrared scan of your body, which allows me to determine the full composition, muscle mass, body fat, bone density, measure points of circumference on 30 points of your body. And
I'm getting on this, guys. You got to get to see
watch
this
that video.
at some point. You're going to have to watch that video. Stay tuned.
So that allows us to really understand the physical composition. And then once everything has come back with the laboratory, it's a follow-up with an extensive plan, a timeline. And, I kind of go through it with, a conservative, middle of the road and an aggressive approach and give people those options because everybody has a particular goal in mind. So I want to work with what people feel comfortable with.
Yeah. And is this something like how often do you see the patients? Is there a membership type of situation? How you keep people on? Because again, consistency is tough for men. I do believe, and this is from my own cosmetic experience, that guys are a little tougher to sell certain things that take any amount of effort or work. But once you have them, they're yours.
Yeah.
I find women, not to over stereotype, sometimes they can have a perfectly good regimen of something, but they're more open about maybe missing out on something else or new. And they also educate themselves a lot more, which could not always be such a good thing.
Sure.
Men, once they see a difference with something, they'll do the same thing regardless of if something better comes out or not. So how do you keep them on board?
So, the frequency of follow-up, I would say, is a cadence of about every 6 weeks, especially if you're doing blood work. Like I mentioned, my app I use to communicate frequently. So I might talk to somebody 4 days a week, 5 days a week, depending on what's going on.
Especially if they're on hormones. Right.
And the blood work is important because when you are replacing hormones, you need to make sure that they're balanced. You need to understand how it's affecting all of your body's chemistry. So it's a very specific, and that's why we call it precision medicine. It's a really specific analysis that needs to be done and followed up frequently. And then there's always something that we could improve or add to. So the body scan I do monthly for people, so that way we can see how things are changing. And it's really fascinating because when you step on the scale, you may not see changes because that number might be the same, but you may be gaining muscle mass and losing body fat, and your waist might be shrinking. And we can look at that on a very micro level.
No one wants to get on this device like right after Christmas, New Year's break. Nobody wants to. I'm going to wait till the end of January.
But that's when you should do it because then you can see the progress and improvement.
Of course.
Because of course, how you feel is the most important part. How your numbers are and your chemistry, that is also critical. But then how you look, as you know, is the other part that makes people motivated. So if you can really see a change in how you look and the rest all coming together, that's the golden ticket. So that's how people are engaged and they start to feel better. And that's the key. I mean, guys who are my patients, my clients, they kind of know that they need this or they want this. They're in that mindset. They already take care of themselves or trying to take care of themselves. They are successful in many ways. So they want to have health success the same way that they have financial or business success or relationship success.
Well, that's why I think when you see billionaires, because listen, again, not to over stereotype, but men usually equilibrate success, financial success, as a positive thing. So if they see someone doing something that's aesthetic or something that's cosmetic or doing something like precision medicine, it reinforces that maybe there isn't as much of a stigma as there used to be, and to feel comfortable about embracing things on the inside.
I mean, the basis of men's existence, if you will, guys versus women, is virility. That is the male trait. So if there is an abnormality in your hormone cascade, you are not optimizing how you were intended to be as a man. So that's really, I think, such an important point because so many men are on antidepressants or they may, be diagnosed with another condition, and it could actually be a hormone issue that they're not addressing. So that's why this is such a critical concept for every guy. And some people have other issues. You said that this is only people who are over 40. I have some patients who are in their 20s, and they just want to work with somebody that takes the time with them.
Now, in terms of deciding on the degree of intervention, this is a difficult decision because we know that there are doctors out there with very low thresholds for certain types of treatments that are very aggressive, and other patients where the doctors won't prescribe what's needed because they're afraid or they don't know how to handle it. So, lifestyle changes versus supplements versus hormones. Like, is it just the blood work numbers? Like, what?
No, I mean, it's really the big picture.
Yeah.
So, most guys are already feeling something that they know is off. You know what I mean? They don't have the energy. They maybe are not as productive. They may have brain fog. So those are typical things that people have.
Yeah.
Then the numbers are always sort of the confirmatory point. When you have those things that we consider highly suspicious for an issue with your hormones, then numbers are the, they seal the deal. But, the numbers part is very interesting. And this isn't just with your sex hormones. It's with your thyroid hormone. It's with cortisol. Lab values have changed in the last 10 years because we are living worse. We have more environmental toxins. We have more stress in our life. We, are not taking care of ourselves. So the lab values have shifted in terms of what's happening in people, not because that's considered a good thing or normal, but because more people have that. So that's really interesting when you understand how to interpret these labs, because many doctors, like I said, they'll do basic blood tests, even if they're doing your testosterone, and they'll say, it's fine.
Yeah.
And that's because the normal range is the same, 300 for some labs up to 800, the same if you're 30 or if you're 70.
Darren, do you have patients? Because again, if you have a patient population of successful people, highly motivated people, high expectations, do you have patients who are, they have too high expectations? A 60-year-old, wants to be like a 20-year-old. In fact, their blood work is pretty good. They're in pretty good shape, but they just won't accept that they can't exercise, have sex, do whatever it is like they did when they're a 20-year-old. How do you deal with a patient like that?
I mean, I think that it's like anything else. I mean, when you have a patient that has unreasonable expectations, you have to address it.
Because there could be dangers if you push things, right? Anything that's good has a potential for
You have to just address it head on. Like in anything in medicine, when somebody's in a critical car accident, you can't say, oh, I'm sure everything's going to be fine when you're a trauma surgeon. You have to be realistic about
and you have to tell people what to expect out of life, because there's pros and cons to everything.
But that being said, there's many guys who are in their 60s that probably could improve their sex life and their activity. And
most.
You know what I mean? So it isn't a barrier, but it has to be factored in.
Now, let's talk about the types of supplementations, because once I did a little research and you came into my life and I had a resurged interest of all this, it seems like the availabilities of products is so much more than when I took my initial interest 15 years ago. You now have, and you're going to explain a little bit of this, you have the peptides, there are things that stimulate natural production, there are nasal sprays coming out, gels, patches. I mean, tell me about these and how do you choose?
So, it's probably a little bit like what you do. You have certain ones that you use.
A lot of different colors of paint.
But you use the ones that are probably the most important and most successful frequently. But yes, there are a lot of different options. And that's why you really need to see somebody who understands this type of medicine.
And it's different for each patient. Sometimes people are like, oh, my friend did this type of filler or this type of neuromodulator. I'm like, well, that may not, it's going to work for you. There's no best. It's finding the best for the right patient. But if you had to say what your most in terms of advancements, like what are the big hitters right now?
So supplements, I think are undervalued, but also incredibly complicated for people. And that's why I created my own, basically, to make sure that it was easy for people and you didn't have to go look for it. You go on Amazon and you look up vitamin D, there's 3,000 options. So if you've never taken a vitamin D supplement, which by the way, most people should be on, it's overwhelming. So, supplements are a foundation that everybody, multivitamins, probiotics, things like zinc replacement should be in everybody's regimen, but you got to kind of know how to do it. Right. Exactly. And then peptides are kind of newer and sexier, have a lot of great efforts. Some of peptides are helping with our immune system. So, some patients can be having signs of illness coming on. You could use peptides to help reduce some of that. Autoimmune diseases, it could be helpful with treating. And then other peptides are used for recovery. So, you
Yeah.
have a ligament injury, rather than taking a lot of NSAIDs, you could be using peptides and sort of help with that recovery in a different way. So super interesting. They're basically small amino acids. A lot of them are either topically when they're used for cosmetic purposes or injected when they're used for other medical purposes.
And are they better in effect? Are they safer? Like, we're going to start talking about the stigma associated with any type of hormonal manipulation, particularly in men.
It depends. I mean, some people swear by them.
Yeah.
Other people don't see as much of an effect.
Yeah.
Some people really want to try what's new and, on the cutting edge.
Yeah.
Other people, sort of shy back from it. And that's why I said it's important to understand what people's goals are and then come up with a regimen that you think is going to work and then have a meeting in the middle.
Now,
So it always depends.
in terms of, because we've spoken about this before, I think way too many people understandably have a very simplistic review of hormone replacement. They think of juicing in men. They don't think about it like that in women.
Right.
When women take hormone replacement, when they think about men taking any type of hormone,
Right.
they think of some guy in the gym with like veins bulging.
Because you see such a physical difference.